The following podcast is brought to you by Kidney Stone Prevention Clinic of Orlando. Hello, everyone, and thanks for joining us. I'm Will McPherson, TEDx speaker, podcast host, and media personality. Dr. Paul Dreyer, welcome to the podcast.
Thank you, Will. Appreciate you having me on.
Dr. Paul Dreyer is a nephrologist with over 30 years of experience treating patients. So, folks, the reason for this podcast is this. Dr. Paul has just started a patient service business that will revolutionize kidney stone care. So, Dr. Paul, tell us a bit of the background. How'd you get the idea to treat patients virtually for kidney stone care?
So, Will, this all started back in my fellowship at the University of Michigan. We had a stone prevention clinic, and we would work patients up and figure out why they were continuing to make kidney stones over years and years and treat them, and they would stop making stones. So I found that very gratifying. And shortly after I started my first job, after leaving fellowship, I was at Thanksgiving dinner, and my wife's great uncle just casually said while we were eating that he made kidney stones every few months, and he had done that for 20 years. And I was astonished. I asked him, had he been evaluated for why he was continuing to make stones? And he said yes. And I asked him, what advice did you get? And he said, well, the doctor told me not to drink milk. And clearly that wasn't working for him. So he had fortunately been evaluated. So I got a copy of the evaluation, and he had excess calcium in his urine. So after starting him on treatment, simple treatment with one medication, he stopped making stones, and he had done it for years and years. And so I started to get an interest, and I would see patients in my practice for stones. And Will, I can't tell you the countless number of times where I treat people, they stop making stones, and they ask me, why didn't I find you 10 years ago? And I like, I don't know. And I thought,
didn't they?
Yeah, exactly. So that's when I thought, there's plenty of people out there that are continuing to make stones. They think they're just doomed to do this every several months to every couple of years for the rest of their lives. But that's not the case. A lot of times you can evaluate patients and treat them and prevent them from making stones in the future. So that's motivated me to start this business, on the internet, and do it virtually, because there's only so many people that live close enough to my office to come walk in and do it. But if somebody's far away and they don't have access to good evaluation, that's what I'm trying to make possible for those patients.
Hey, Dr. Paul. So we don't want to throw other nephrologists under the bus, right? They're doing a good job. They're treating stones. Yeah, I know. Yeah, no, I'm not. I know you wouldn't. But they're being treated. But you take it a step beyond that. You actually take the time, right, to delve in and find out exactly why they're making stones and hopefully stop them. So that's great. So you stated this concierge service, it will be available virtually. Is it virtually only? Can they come into the office or?
Yeah, they're welcome to come to my office. I have an office in Orlando, Florida, but and this is restricted at this time just to patients that live within the state of Florida, because that's where I hold my medical license. If they live far enough away, then I will work with them virtually.
Right.
To try to help them and treat them.
And that would be on your website, right? Which is kspfla.com. Once again, that's kspfla.com.
Yeah. We also have a phone number.
Go ahead.
239-221-1281. And our email is clinicalteam@kspfla.com.
Easiest way, though, I would think, right? There's a lot of ways to look it up, but kspfla.com sounds like the best way to reach you. And Dr. Paul, so why is your organization so different from what's available out there?
So to kind of go back to what we were saying previously, Will. Patients, there's different aspects of kidney stone treatment. If someone is actively passing a stone, they see urology, they might need lithotripsy or some other surgery to extract the stone. That's not my part of the care. My part of the care is, why do you keep making stones, and do an evaluation? And there's oftentimes just simple interventions that can be done to prevent them from making stones again in the future. And I don't know. I mean, like I said, I take a special interest in this. So whether other people haven't had as much experience and exposure as I've had, because I've honed it over time, learned little tidbits and rabbit holes to chase down to, because it's not one size fits all. Patients have various issues. And so treating one patient could be certainly different than treating the next patient who doesn't have the same reason for making the stones.
So this sounds like a great add-on, right? So you're getting care from your physician, and you're interested in why am I making these stones, and how can I stop them in the future? It sounds like a nice option, to either go in the Bricks and Clicks office in Orlando, or more conveniently, go online and have a virtual session online at kspfla.com. Dr. Paul, as we wrap up here, why did you choose the kidneys as your focal point of expertise?
I chose kidneys because I like kidney physiology. I like the variety of the work that we do. And it can be difficult. We have difficult patients that we treat with kidney failure, with needing dialysis, with needing transplant. But the nice thing about the kidney stone business is that this is something where people, it's not something that will be life-threatening, but it is something that is certainly painful and aggravating, and so that folks are really motivated to be evaluated and follow up and get treated. So I find a lot of satisfaction in it, and the patients that I've treated also are very, very happy.
Dr. Paul, do you accept insurance?
So that's the issue. So the concierge business would be cash only online. If you come to the office, then we would process your insurance, and I would use that. As far as paying me, if the evaluation that you get with the labs, et cetera, medications, then your insurance can certainly cover those costs.
Sounds like a great add-on. It's a nice concierge service. You don't have to drive. Florida's an awfully big state. And Dr. Paul, is your ambition to practice beyond Florida?
Yes. So I'm looking into that now to try to determine how we can get reciprocity with other states, so I can do it in more states throughout the United States. That would be the goal.
Dr. Paul, thanks so much. Folks, this one is for real. Dr. Paul's virtual clinic is up and running. It's a great service to the state and soon to be beyond the state of Florida, but it's on kspfla.com. You can reach Dr. Paul and his staff and get you set up for a consultation. Thanks so much for everybody for listening. And thanks, Dr. Paul. Super excited about your new business.
Thank you, Will. Appreciate you.
Thank you, Dr. Paul, for joining us. Once again, you can reach Dr. Paul with any questions at www.kspfla.com or at 239-221-1281, the Kidney Stone Prevention Clinic of Orlando. Until next time, folks.